Neck pain is not a neck problem, it's a brain problem. And if you keep treating it locally, like stretching, massaging, cracking it, you might actually be making it worse because you're chasing output, not input. And your brain does not care how flexible your neck is. It cares about safety, it cares about clarity, it cares about control. And when those are not there, it creates tension, it limits your movement, and creates pain. Not because something is broken, but because something is unclear. So you more likely been, stretching more, pushing harder, forcing the range, but the brain still doesn't trust it. And over time, your system adapts to protection and your posture changes, usually moving forward or your head sideways, your breathing changes, your energy drops, and your focus decreases, and your performance suffers. And not just physically, but mentally, emotionally, behaviorally, because the brain controls everything. But here's the shift. When you change the input, the brain updates the output. So pain can actually decrease, movement can improve, right? Tension reduces, and your body starts working with you again instead of against you. Welcome, I'm Heike Fallon. I'm the founder of Expand Health and the creator of the NeuroHP method. I combine neuroscience, sports therapy, and personal performance coaching to help leaders, athletes, active people like you optimize their health and personal performance for longevity. Over 30 years, I've studied the brain and the body and their connection. And today I want to share how to fix your neck by working with your brain. We'll go deeper than most approaches. We'll look at how the brain actually interprets safety, how you use your eyes to guide your neck, how you use your inner ear to stabilize more movement, how breathing loads your system, how sensory input drives the output, and how you can change all of it with targeted brain-based exercises. Before we go into it, make sure to grab my free PDF guide below in the description. Download it, work with it. It's a fantastic way to get started. But let's dive in. Most people focus on the neck, but the neck is responding. It's not leading. Chasing pain locally focuses really on the output, not the input. And your brain is consistently predicting. It builds a model of your body in space, and that is your body map. And that map lives in your brain, not in your muscles. So the brain uses visual input, vestibular input, all kinds of sensory input to update that map. If that map is unclear, the brain increases protection and protective output, right? And that includes muscle tension, movement restrictions, pain signals. And pain is not just a signal if there's something damaged. Pain is actually a signal that there is a perceived threat. Without anything wrong, you can have pain. So any threat can cause pain without any structural situation, anything wrong structurally. When the brain senses uncertainty, it prioritizes protection over performance. Think about it. High-performing leaders, long hours, high pressure, constant input. The brain becomes overwhelmed by information, and if that information is not well integrated by the brain because some sensory systems aren't working well, the brain becomes more protective. The neck tightens not because it's weak, but because the brain is uncertain. So instead of forcing the neck, we improve the input to the brain. Biggest thing, as I said, visual system, very important. Your eyes are your dominant sensory system. Up to 70% of sensory processing is visual, and your brain uses vision to understand where you are, what's moving, what's stable. And if your eyes don't provide clear information, the brain compensates by increasing muscle tone, especially in the neck. And that's why also sitting at the computer and not moving your eyes can have such an impact on neck tightness. And again, the neck stabilizes the head, which stabilizes your visual field. So there's a direct correlation. And we're going to do a couple exercises right now that you can follow along for your vestibular system. So this one is called Smooth Pursue. And before we start though, we want to check and see how your neck is doing right now. So I'd like you to do an assessment. You're going to turn your head to the sides, feel how tight it is. You might do rotation. You might check with the side tilt. Also, I'm doing it standing right now. You might want to start seated if you know that your system is a little more vulnerable, or if you do an exercise, we're going to go through 10 exercises. So if you doing an exercise that gives you more tension, more tightness, or less range of motion, you want to sit down doing it, or even lying down. I have clients even lie down during an exercise. So it depends on how your system responds to the input. So I'm standing right now, but you might want to start seated. So again, we're checking the range of motion and just get a hang of it. Obviously, it's always good to make sure you first have a tall spine so you're not rotating with your head forward. So tall spine, rotating, shoulders are relaxed. Good. So what we're going to do is we're going to use the thumb, okay? And what I would like you to do is you're going to hold the thumb at eye level, and you're going to slowly move the thumb to the side and your eyes follow. And then you come back very slowly. Let's do that again. So your eyes stay on the thumb. As you move the thumb to the side, the head stays still, and you come back. And again, follow the thumb. And you can come back without looking at it too. Let's do one more time. Stay on the thumb as you move it. And come back. Now let's check if the range of motion changed. If you feel a little less tension, more likely on the right side, but it might also be the other side. Again, if you test it this way, check that way as well. We always want to assess and reassess and see which of these exercises might be better for you, because we're all different. We all have different history. Brains respond differently. So one exercise that works really well for me may not be good for you, or vice versa, depending on what inputs your brain needs. Now let's do the other side. Again, we hold the thumb at eye level. We're gonna have a good tall spine. Gonna stay with the eyes on the thumb. As the thumb moves, the head stays steady, and then we come back to neutral. Again, if you're not sure if you're moving your head, you can place the other finger down there and come back. And we're gonna do one more. Come back and reassess. So for me, that definitely loosened up my neck. Again, if you have less range of motion, maybe do it slower, maybe seated. If you have the same and nothing changed, maybe this exercise is not the right one for you, but one of the other ones, maybe. So what we did here is we trained eye tracking, that's visual control, brain accuracy, and this reduces the need for neck tension because there's good information coming in through the visual system. Another really good exercise is a near-far focus. We're going to do the same thing again by first assessing our range of motion, see how we feel on the neck. Also just check in how tight your overall muscles are around the neck. That might give you a good indication too. So this one, you're gonna, again, stand or sit, hold the thumb at eye level right now. So you're gonna look at your thumb and then at a target a little further away and back to the thumb. At a target further away at the thumb. So we're gonna switch back and forth about 10 to 12 times. Make sure you have a specific target. And then we're gonna reassess. So for me, that really loosened up too. Even the side actually feels a little better. I still have a little tightness on the lateral flexion, but it is getting a little better. So see how you responded, okay? So now let's talk about the vestibular system, your inner ear. That controls orientation. It detects your head position, movement, acceleration. It connects directly to your neck through reflexes. So it's very, very important. And that's also a reason why it works. One key reflex stabilizes your head automatically. And if input is unclear, the brain increases neck tension to compensate. So we're going to do a couple exercises for your vestibular system. They seem very small, but they can have tremendous input. So the first one is we're going to do small little head turns. Again, going to quick assess, see how we are, and going to go sideways. Now I recommend using a target not too far away. Or holding the thumb here, but the problem is when you hold the thumb here, you already having a little tension there. So let's try to have just a target ahead. So since you're watching me, find something maybe on your computer, or if you're on the phone, pick some target that's not too far away, maybe a foot or two, and keep your eyes on the target, eye level right now. So I have a target right there, eye level, and we're going to start with small head rotations. That means we're basically saying no. Again, I don't want you to go too big. Keep it small right now. If you're feeling kind of weird, dizzy, uncomfortable, and relaxed, then that means you probably should be sitting down because you're already getting a threat response output by feeling woozy or dizzy. So obviously stop. Let's reassess this one. That definitely got me again a little better as well. And we're going to do another one right after, which is head nods. Same thing, same target right now. And what you're going to do is just small little up and down. So saying yes, nodding, going up and down, keeping the eyes on the target. Small movement. Make sure you keep breathing. Good. And reassess. So my rotation got really good. Side bends or like deflection are okay. I like to have a little bit more there if possible, but I know we have a lot more exercises to go. So we're gonna keep going. Breathing is another very important component. Breathing is regulation, not just oxygen. It is controlled by your brainstem and linked to your nervous system. And when stress increases, breathing becomes usually very shallow and fast and more chest dominant, and your neck muscles help. And they help lift, also everything helps lift, lifting the rib cage to get air in. And they work all day long, and that creates tightness, fatigue, and pain. And oftentimes we need to just learn to really utilize our diaphragm again. But instead of now doing like a big long exhalation or anything deep inhalation, we're just gonna do basically an awareness still first to pay attention to how are you breathing and how are you inhaling and exhaling and which muscles are you really using. So to start, I recommend having one hand on your chest, one on your belly, and all I like you to do, now I'm gonna close my eyes because I think it helps better to focus, but if that makes you feel dizzy or uncomfortable, keep your eyes open. Again, you might want to sit down or lie down. So what we're first going to do is just inhale and exhale. Now I recommend inhaling through the nose and exhaling through your mouth. And now check in. Which hand has more movement? The one on the chest or one on the belly? How relaxed are your shoulders? Now breathe a little bit more into your chest and feel the upper hand move. Two more times. Last one, inhale through the nose. Exhale through your mouth. Now let's focus on the lower hand. Inhale. See if you can expand the belly. Try not to expand the chest. We're focusing, inhaling into the belly. So the lower hand moves. Good. Now we're going to change the hand position, because when we use the diaphragm, it's really not just belly breathing. We should really be breathing all the way around. So I like you to kind of rub the sides right now a little bit, all around, give it a little sensory stimulus. And you really want to think of inhaling in all three directions when you use the diaphragm. So let's do a few more breaths on those. Inhale. See if you can expand the rib cage, and exhale. So the lower ribs should really expand to the outside. If you have a hard time holding your hands like that, you may put them this way. Or oftentimes with my clients, I use a TheraBand around, and that can give you some good feedback too. One more time. And long exhale. Good. Let's reassess. That stayed really nicely for me, and that actually got a little better too. So this helps you focus on the diaphragmatic breathing, and the diaphragm is really what activates the vagus nerve. And the vagus nerve is a big part of our parasympathetic system, our rest and digest, and it really helps calm the overall nervous system down, particularly when the situations might be more stressful. So now let's do an exercise that integrates breathing and movement. So what we're going to do now is, again, sit or stand. You hopefully know right now where your range of motion is. And what I would like you to do now is you're going to inhale. As you exhale, you rotate your head. Inhale, coming back, using the diaphragm. And exhale, rotating. Inhale. And exhale. Inhale. One more time to this side. Exhale. Let your eyes be soft. Going to the other side. Exhale. Inhale. And exhale. And inhale. And exhale. Relax the shoulders. Good. Let's reassess. Very nice and smooth. Oh, that was good for me. So we integrated here breathing, movement, the orientation, and this is a great combination to reduce the unnecessary tension in your neck. Another very powerful input is your ear, because it connects to your nervous system, and that can have a tremendous input as well. So the vagus nerve actually, yes, it connects to the diaphragm and everything down here, your lungs, your heart, and all that, but it also comes out, is here by the ear, below by the neck, and in the ear. So it's a really, really powerful connection. And as I said, the vagus nerve is the biggest part of the parasympathetic system. So we can, with different exercises around the ear, activate the vagus nerve. One is by gently pulling the ear. So we're not yanking the ear, but we're just going to gently pull it. So we're going to start with first rubbing a little bit the earlobes. We're just gently massaging. And again, anytime something does not feel good, please stop. Okay. Now we're going to do a light pull down at whatever you're comfortable, and then a little bit out. And yeah, don't worry, the ears aren't going to get bigger. That's okay. But you want to feel a stretch on the skin. Very good. Good. Now we're going to also pull a little bit back. Do whatever feels comfortable. You can also kind of hook in and just gently pull like that. Again, you want to feel a light stretch and you want to pull up. Now you may also just do one ear at a time if that feels better to you. If you don't want to do both ears at the same time. So we're going to pull up right now. And then one last time pulling down and out. And you feel like a really nice stretch here. You might actually feel a little bit relaxation automatically already happening. Good. And we're going to assess that again with a rotation. And ooh, that went way further for me right there in the lateral tilt. So see if any of those work very well for you. So here's another exercise utilizing the ear. This one you just need a finger. Oftentimes I like to use a Q-tip. We're not poking in the ear. That's not what we're doing, but we're gonna go right here on that little spot on the ridge, right in there's on the outside basically of the ear. We're not in the ear canal or anything like that, but just there at that point, we're gonna put the finger right there and just decide what pressure is right for you. And then we're going to move the skin around in there in small circles. So it's a light pressure. So we're not poking too hard. Light pressure, making circles, and decide the speed of your circles. Whatever feels comfortable. So you want to check in. If it feels stressful, that's not the right pressure. It might not be the right speed. You might want to just kind of slowly go, or you might just hold. You may not move. So see whatever and feel and check in what is good for you. Okay? It's not all the same. Let's try the other side. Again, we're talking about finding the spot right up here in the ear, right there by the ridge, holding the pressure. Or whatever feels good to you. If small little circles felt good to you. Sometimes also back and forth movement might feel better. Definitely want to kind of pay attention on how you feel. Don't push too hard. And let's see how that goes. Well, that got me a little tighter actually. I did not like that for my right side. So this exercise was not the greatest for me. Hopefully I'm going to fix it with the next one. We're going to talk about the jaw. The jaw affects your neck directly through neural connections, and jaw tension increases neck tension. So for this one, I want you to stand again tall or sit, and let the tongue just relax right now. And we'll gently open the mouth. And what we're going to do is we're going to massage a little bit the TMJ, which is the jaw joint right back here. Very gentle massage. You make also do little circles. Keep the shoulders relaxed. And you may also hold pressure, whatever feels good to you. Make sure the jaw's relaxed. And let's reassess. That got me again a little better, but not as good as it was before. But we have one more to go. The brain loves coordination. When systems work together, the brain feels safer and more efficient and less protective. So what we're going to do now is we're going to do a eye head different direction kind of exercise. So you want to again stand tall, Check again your range of motion. See what is your current range of motion. How does it feel? And here we go. So stand tall, thumb ahead. And so now I'm going to move my head to my left and the thumb to the right. So thumb is eye level. My eyes stay on the thumb. So I'm slowly going to move my head and move the eyes to the side and back. The eyes stay on the thumb. Eyes on the thumb, so the eyes move to the side. My head moves the opposite side. And again. It's a coordination. Good. And switch. At the thumb, eyes stay at the thumb. Head rotates to the opposite side. Now, yes, you have to coordinate your hand movement. Excellent. And let's reassess. Yeah, that got me definitely better again. Fantastic. So this challenges integration and it improves control, coordination, which can help reduce compensation. The brain integrates everything. Eyes, inner ear, breathing, the body, all at once. And it takes repetitions, consistency, time. Like learning any new skill, your brain adapts, but it needs consistency. Consistency rewires the system. Now, all this is not just for pain or tightness. This has actually to do with focus, with your energy, with clarity. And if your system is in protection mode, you cannot perform at your best. Performance starts in the brain, and the brain can only do one thing at a time, protection or performance. It will always choose protection, and reason for that is because its main job is to keep us alive, and for that it needs to protect us. So let me show you though how we work. We don't chase symptoms, we upgrade the system, the brain, the body, the environment. It's about sustainability and self-leadership. You don't fix the body, you upgrade that whole system. So when we look at neck pain is neurological, and when you change the input, that changes the output. So don't forget to share this video. If there's anyone that you can think of would benefit from this, please share with them. I'm consistently uploading new science-based content, so follow along. Exercises will always be part of this, so subscribe to my channel so you won't miss out. But in any case, I'm Heike Fallon, and I hope you will start investing in yourself. Start today because you deserve it. Thank you for watching, and I'll see you in the next episode.